Welcome to this interview. I'm Michele Calabrò, member of the Young Forum Gastein and Policy Advisor at the European Patients Forum, and I'm here with Julia Hagen, Director of Regulatory and Politics at the Health Innovation Hub under the German Ministry of Health. Julia was one of the key speakers during the session, Driving the Digital Transformation of Health, Now or Never, organized by ELT Health during the Gastein Forum 2020. The session itself was focused on how digital health is here to stay, and the COVID-19 outbreak even demonstrated the importance of digital health in our health systems, but also the need for more frameworks and structures to advance on digitalization at the European and national level. And this is what we're going to discuss today with Julia. So Julia, welcome.
Thank you.
And thanks for accepting this interview. And I will go with the first question. During the session, you presented the DiGA framework for digital health applications in Germany. It's a new framework, so could you please just briefly introduce it in terms of key elements?
Yeah, sure. I'm glad to do that. So DiGA, that's what we call digital health applications, so mobile or web applications that are medical devices of low risk categories, risk class 1 or 2A, and they have to go through a procedure at the Federal Institute of Drugs and Medicines in Germany, and after that, if they accept it, they can be reimbursed by the statutory health insurances in Germany, and they can be prescribed by physicians or psychotherapists, basically. So we are introducing them as sort of a digital drug, if you want so.
That's indeed a good example of a new framework to kind of really integrate digitalization more in the health systems. And I think what would be nice to have is a bit of do and don'ts from the DiGA experience. So what are the key learnings and next steps, and at the same time, how could you see the scale up of the experience to more complex digital tools, and eventually also how it could be integrated in a broader EU dimension on digital health?
Well, I think one of the lessons learned is definitely to start small. So this was, of course, quite a big change for the healthcare system, but we wanted it to start small with a limited set of digital health applications, so only the low risk profile applications, because we know that the way we implemented the framework, this is not going to last forever, but that we will have to adapt it regularly. So it's an ongoing process, actually. I think this is something lesson learned. Don't expect to build something that lasts forever, but accept to continuously change and adapt. I think what definitely was complicated is that it turns out that there's such a big need for information and explanation to all the different stakeholder groups that are not their representatives that are sort of involved at the national level in these discussions, but physicians, psychotherapists, and patients throughout the country who actually need information and need to understand how this works. And this is definitely something that keeps us busy still, and will keep us busy for the coming month and probably years. And I think that the European aspect to this whole development is already quite significant, because for the digital health applications, we are building upon the medical device regulation. So they are all the digital health applications, all the DiGA, they're medical devices, so that we already have a common European framework, which is great. We rely on our common framework for data protection, the GDPR. And then I think it will be interesting to see also in exchanging with other countries who have implemented similar frameworks, for example, the UK or Belgium. Well, I mean, despite Brexit, but still, the exchange should definitely go on. So we really want to see this exchange of experience, and then to see how we can further develop this and scale it up eventually to other type of medical devices, and potentially to see similar frameworks in other countries, which of course would be great with regards to the European Union as a real ecosystem for digital health.
Thanks a lot for that. And the third question, you touched a little bit about it in terms of how you involve other key stakeholders. So yeah, my question would be, how did you manage to involve the stakeholders from patients to healthcare professionals in both coming up with this model and eventually increasing its acceptability in the cross population?
Well, the whole this whole framework was preceded actually by sort of a stakeholder dialogue over roughly 2 years with different projects, sometimes research oriented within the health ministry. And this process was sort of a big stakeholder process with all the different stakeholders. And I think that helped. But then in the end, at some point, this becomes, of course, a very political process, and then Parliament gets active. And then, of course, we had a lot of discussions and also very diverging interests. Industry, payers, patients, physicians, everyone, of course, wants to make sure that this works best for the group they're representing. But globally, we managed to more or less include everyone, at least as much as it's possible. And of course, as I said, the dialogue is continuing, and it's now about to see how we also might have to change it. Is there other kind of information on a digital health application that we need to provide to physicians, or do we need to modify the prescription process for patients because for some reason that's not working for them? So this is part of the ongoing process.
So yeah, indeed, a pre-involvement and then an ongoing process. That was your way to go, and I think it's quite a good learning from it as well. And this also leads me to the last question. In the session, you mentioned that Germany might not be at the moment the best country in terms of digitalization, but it's one of the ones that is going through the strongest transformation. So what other EU countries can learn, even beyond the DiGA experience, to make this digital transformation easier?
Yes, well, I think we definitely need to underline that we are not at the front, among the front runners when it comes to digitalization in healthcare. Definitely not. We are far from the Nordics, or take especially Estonia as an example. So we're far from there. But at the same time, during the last during the past years, the health minister really prioritized the digitalization of healthcare and set the ground for a lot of changes in the system. That was sometimes a bit overwhelming for some stakeholders because a lot has been happening, or a lot of changes in the regulatory framework have been happening, and now it's about implementation and about getting this really to the patients, to the healthcare professionals, and so there's still a lot of work to do. But I think at some point it's important to get started, because something that kept us, I think, in the last decade from actually advancing was over-engineering, finding the perfect solution, the best of what is available, and that led actually to over-engineered processes that still haven't been implemented. So at some point, you got to start, I think, maybe knowing that, as with the digital health applications, that this is not going to be the framework that is going to last forever, at least not in the initial form, but that we are willing to move it forward as well.
So this was my last question. Thanks a lot for your inputs. Indeed, it's great to learn from the German experience, and more information also available on the report from the session itself. Thanks a lot, Julia.
Thank you, Michele.
And thanks for the interview.